Welcome to NurseEmerge, where we enlighten and empower nurses and nursing students to excel in their chosen specialties. Join us as we illuminate the vast world of nursing, providing mentorship and guidance to foster a community of future healthcare leaders. Let's dive in.
Hello, professionals. NurseEmerge here again. We are doing something really unique today. We are diving into a unique specialty, pediatric nursing. I am Precious Lyro, NurseEmerge founder. Here with me, I have one of the renowned pediatric nurse professional from UCH, Ibadan, Dr. Mrs. Felu Oyewonke. It's good to have you here, ma'am.
Thank you so much.
NurseEmerge is so privileged to have you here, and we will not take this opportunity for granted, ma'am.
Thank you so much.
So today we will be asking some valuable questions to provide valuable insight into pediatric nursing. So I will start with the first question here, ma'am. Can you share a bit about your background and journey into pediatric nursing, as well as what inspired you to specialize in the field?
Okay, thank you very much. I started my nursing career as a general nurse, as a midwife. But after some years of practice, personally, I have passion for children. Then I have had cause to rotate through several units. And then after some years of practice, I discovered that my passion to work or to take care of children needs to be solidified in educational background. So I know that children don't have, I feel children are kind of marginalized in the sector. And so I was driven by that passion to speak for them and then care for them. So that was one of the things that led me to pediatric nursing. And as nature will have it, I got a little challenge along the line, and that made me to be transferred to the pediatric nursing, which is primarily my passion. So when I got there, I saw the need that, I can grow up in this, and that's what led me to.
Thank you so much, ma. There's something unique here, passion. Don't just go into something that you did not like. From what she said she likes what she does. So it is passion that is the drive here. So okay, we'll move to the next question here. What are your primary responsibilities in your daily role as pediatric nurse, and how do you contribute to the care and well-being of young patients?
Okay, thank you very much. Let me first say that pediatric nursing takes care of children from, I would say, before birth, because care of children actually starts before birth. So I would say that in this country, children are classified as birth to age 18. As from age 18, you become an official adult. So our care covers pre-birth till age 18. So let me talk about preconception care. Preconception care is not only for other specialties. I would say that preconception care is part of the things we also look into, that as a woman of reproductive age, there are some things we do before you conceive. It's part of the things that we do for the sake of the babies to be delivered. And so during pregnancy too, you are primarily taken care of by the midwives. And then immediately the baby is born, our care continues. The pediatric nurse makes a good assessment of the baby at birth. The eyes of a pediatric nurse sees better, sees further, understand and identify earlier than any other professional, because that is part of the things we're trained to say. What others may classify as a general issue, a pediatric nurse will see beyond the general and pick the specific on time. So our care continues after the delivery of the baby. We ensure that the baby is safe, is well taken care of nutritionally, psychologically, physiologically. And from there too, part of our care is we give us education to the mother to ensure that the babies are well taken care of, vis-a-vis their nutrition, immunization, and other care. We also educate the next group of children after age 0 to 5. And we talk to their mothers, because at that age it is still their parents that are primarily their caregivers. We take care of their health, vis-a-vis their nutrition, their emotional needs. Let me also say that one very unique thing we do as pediatric nurses also is to take care of the pains of children. That may sound absurd, but children also have pain, and this is expressed in different ways. A good pediatric nurse will tell you a classical way of assessing pains in children and the way of handling it. So, aside that, we also take care of the emotional needs of the children. We take care of their parents as a whole. We take care of them when they are sick. We take care of them when they are not sick. It is also pediatric nurses that have special plans for the adolescents because we know they are vulnerable at that age. We take care of their health at that age. We look at things that can make them to be vulnerable wisely, and we look at things that can make them to be better. We look at their special needs at that age. I mean, that's also not peculiar to adolescents. We look at special needs of children at different age, and we offer appropriate care according to age. So I would say summarily that we take care of them when they are sick. We take care of them when they are not sick. In the hospital too, a pediatric nurse makes a detailed assessment and can actually make diagnosis of some ailments. At the primary health care level, you can actually take care of some illnesses and then make appropriate referral. So I'll say that's part of the things that we do. This we do till we hand them over to adults, other professionals who take care of adults from age 18.
Okay, thank you so much.
Let me also say that we are involved in research. Pediatric nurses are involved in research. We collaborate with others to do research and identifying new or novel areas of what can we do. Particularly, we're also involved in research that will unravel a lot of things that children pass through. You know, children cannot say specifically this is what they are passing through. Pediatric nurses are like the voices of the children. We are like people who sees what others don't see. We understand their feelings. We can interpret their feelings. Unlike an adult that will say, I have a headache, I have this, but a child may just be giving you attitude, and then a pediatric nurse will gladly or confidently interpret that attitude to know what exactly the child is passing through. So we take care of them while they're sick and while they're not sick. We're also involved in research activities.
Thank you so much, Ma. That's a lot there. It's a detailed thing about what the responsibility is all about. So actually, one of the things that struck me the most is taking care of them while they are well and while they are not well. It's not only when patients are sick that nursing has to be caring for them. You know, in our field, we are actually caring for. So it is not only about when they are on the ward. They still order some things. And another thing there is that they take care of their mothers, their parents too. They take care of them psychologically, physically, and others like that. Okay, so the next question. What educational background and training are essential for aspiring pediatric nurses, and how does one become a pediatric nurse?
Okay, thank you very much. So far so good in Nigeria today. Pediatric as a specialty. To acquire certificate in pediatric as a specialty, you must have had a background. You must have been certified as a registered nurse, and then you proceed there as a post-basic course. But like the Nursing and Midwifery Council of Nigeria is proposing currently, all our post-basic courses are being moved to postgraduate courses, so that essentially after your first degree, you can go in for pediatric nursing. But for institutions that are yet to link up with university or yet to affiliate their programs to university, you can actually do pediatric nursing after being certified as a registered nurse. So thereafter, you go in for the program for a year, you write different exams, the qualifying exams, the hospital finals, and then when you pass successfully, the council registered you as a pediatric nurse in Nigeria. In pediatric nursing too, there are subspecialties, which may not necessarily mean that you go for a certificated program of years, 1 year, but there are subspecialties in pediatrics. You can actually be a micro specialist. You can go for a micro specialty in pediatrics, like pediatric emergency, neonatology nursing, nephrology pediatric nursing. Meaning that if you are a pediatric emergency nursing, you specialize in pediatric emergency care.
Wow.
If you are a neonatal nurse, you specialize in taking care of neonates. We can also have nurses who specialize in PICU, pediatric intensive care unit. Wow. So we can also have nurses, pediatric nurses who specialize in taking care of babies who have kidney issues. They are the ones that are actually trained to do peritoneal dialysis, renal dialysis, hemodialysis, and all sorts. They take care of children with nephrology issues. So we cannot actually have those sort specialties. Those sort specialties are not currently being offered as a course in Nigeria, but after being our training as pediatric nurse covers all those areas, but you can actually major in those specialties too.
Thank you so much for the detailed information. And I would like to ask, where are the schools located here in Nigeria? Okay,
I know we have at least 3 or 4 schools. One is in Ilorin, under University of Ilorin Teaching Hospital, which I know they are also making effort to affiliate with University of Ilorin. A very good effort, a very good progress. Yeah. There's another one in Lut, a School of Pediatric Nursing in Lut. I know by now they're also trying to affiliate with the university or move all of their programs to higher national diploma, like the council has given us option of either degree or HND. I know there's another school in UBTH, that's the University of Benin Teaching Hospital. So we have them scattered all over the country like that. But I know the schools are not so many in Nigeria.
Okay. Thank you so much for the detailed information. So you need to know that nothing has moved beyond what you are seeing it of. It's more than just the scope of nursing. You have to see beyond what every other person is seeing. So, okay, to the next question, what challenges do you face in pediatric nursing and how do you overcome them?
Okay, there are so many challenges, not peculiar to us. And one of the challenges is under remuneration. And under remuneration or poor remuneration will come because people do not appreciate specialty in this part of the world. I bet you that the best care is given by specialists. And so if people appreciate the work of specialists, remuneration will be good. So like any other professional nurse, we're also grappling with poor remuneration, the poor recognition as pediatric nurses. Many people don't know that what we do is actually beyond what an ordinary person will do. Like I said earlier on, a nurse can just look at a baby and say that this baby is this. A pediatric nurse will look at that baby with a wider eye, and we see what an ordinary person will not see. And this will prevent complications after all. And then the care we'll give is not comparable with any other person we give. So, part of the ways, one of the things that keep me moving is my passion for the work. I get my satisfaction not necessarily from money alone. I feel fulfilled seeing babies that I know coming to do well. I feel fulfilled when I work in emergency and I see a baby rush into the emergency. Everybody's scattered, relations scattered, parents crying, and we're able to do 1 or 2 things for that baby. And the baby is back, and in another 24, 48 hours, everybody is happy. I'm also very happy because it means I'm impacting life. And the joy of it again is seeing your patient's mother in market shouting, Mommy knows, see, Kafila that you took care of, see this. And the baby rushed to you to hug you. Personally, I feel fulfilled that tomorrow is secured because we're taking care of them today. We're not bringing up children that we will have to spend so massively on to be good in life. Because if we take care of children today, we'll prevent a lot of complications, and our economic value will also improve because we have healthy children tomorrow who can actually take over from us, and our mind will be at peace.
Thank you so much. Another thing there is that passion. For everything you do in life, there's challenges. So for any specialty you want to go into, even though it's what you like, there will be challenges. But there's something that you will use to overcome that thing. It is what? Passion. So to the next question, okay, can you share a memorable patient success story that highlights the impact of your care in pediatric nursing?
Okay, let me say without reservation that neonatal nursing care, neonatal care is basically 70% nursing care. It gives you joy when you manage a 700-gram baby, 0.7 kilogram, and you successfully manage the baby, and you see the baby celebrating their birthdays. I mean, it gives you satisfaction that hope is not lost. And why any other person will give up on a small baby and say that this baby is too tiny to survive? Right. A pediatric nurse will see life in that baby and keep striving until we see the baby come alive. Another good story is me seeing a baby rushed in. I had a lot of good experiences in children emergency units where a baby is just rushed in with PCV of 12%, 10%.
Wow.
That's maybe almost gone. We have various features saying that baby is decompensating, not showing signs that it's going to be alive. But you move and things work out. And you see a baby that everybody was crying for in another 30 minutes ago, after transition and doing this and doing that, close monitoring, and in another 1 hour, the baby just yelled and said, "Mommy, mommy, I want to eat this, I want to eat this." It's like a transformation. Personally, it does not mean it's over, but it gives you a good signal that, oh no, we are making impact here, and babies are doing well. For me, a lot of satisfying experience, and I was stay put to this specialty because personally I feel fulfilled, I feel glad, I feel satisfied seeing those children come to life. Seeing a baby of 600 grams, 0.6 kg, and you successfully managed, and one day the parents call you that your baby is in 5th birthday, and you remember the 600 gram baby that they brought some years ago. You are fulfilled. I'm happy, because it means that not all hope is lost. This is what they do in developed countries, and this is one of the things we also talk about. I'm sure they have equipment, if they have adequate government support, we have enough personnel in this country that can transform the health industry in this country, and people will come back here to come and seek our services. We're not doing badly. We're not doing badly.
Wow. Thank you so much, ma'am.
Thank you, sir.
Thank you so much. In fact, sharing some things about your experience, what you've done in nurse profession. Please kindly, anywhere you see a nurse, just respect them. Especially pediatric nurse, respect them. Because sometimes I used to wonder that some child that cannot even talk, how do you, So, but in that kind of thing, you have to give them holistic care. That's what we call holistic care in nursing, and it's really great work. Seeing hope that's lost, seeing life coming back. That's a great one there. Thank you so much, ma. Okay, to the next question. How do you stay updated on advancement and best practice in pediatric nursing, and are there specific resources or organizations you recommend for professional development?
Okay, thank you. There are professional organizations. We have Pediatric Nurses Association, NAMPA. We also relate to Pediatric Association of Nigeria, which is made up of pediatricians and pediatric nurses. Now, come to resources, and these groups organize conferences year in, year out, where we get us updated, and then we are opportune to present our research articles or research work there by submission of abstract, and then you do either paper presentation, direct presentation, or you do poster presentation. But there are other opportunities. We attend conferences where we get updated. We are opportune to also participate in online activities. We can also participate in researches looking at what goes on in the pediatric world or in the pediatric population. So we get updated by reading research publications also, and get those things related to our own setting. Don't forget that our setting is different to other settings, but we also have similarities. So we can extract outcome of articles, outcome of researches, and see if we can work out in our own country. So we adapt them to our own setting. So those are a few areas. The Nursing Administration also organize training modules under MCPDP for us. Sometimes we have pediatric modules. Sometimes we have other modules that get us updated on our activities, so that we are kept abreast of relevant and updated information about our children that we're managing.
Thank you so much. So there's always a room to update your knowledge. So, okay, to the next question, ma, can you describe the teamwork dynamic within pediatric care team?
Pediatric
care team.
Care team, okay, thank you. We have a good working team. Well, not only restricted to us in pediatrics, the language all over the world is teamwork now.
Yes, ma'am.
Nobody can treat a patient in isolation.
Yes.
If you take care of, I used to look at the surgeons. If you operate a patient, you just walk away. If your wound breaks down, you have not succeeded at all.
Exactly.
And so you need a nurse who will take care of that wound, who is a surgical nurse, who you will work together with. So we have a good working relationship. I just said that the Pediatric Association of Nigeria has a component where pediatric nurses are incorporated and where we are also carried along in being updated in what goes on in the pediatric population. So we have a working relationship. And generally, I tell people that wherever you find yourself, you should just have a good working relationship with people, because that is when your work can also come out better. And I will also say that when you have brilliant or you have intelligent pediatric nurses, the efforts of the pediatrician also come out very fine, because you're speaking the same voice, you're pursuing the same goal, using different methods. While the pediatricians may come around, review the patient, give his own recommendation, someone bring the recommendation to pass. But like I also say that it is not just about bringing the recommendation to pass. We don't work robotically. We also apply knowledge. And so we look at what we want to do and look at it vis-a-vis what the child is passing through and see if it's actually synchronized. So we have a very good working relationship with pediatrician and other teams.
Okay, thank you so much. That means there is much more things we have to work together with other professionals. In nursing, we know generally that we need to work with other professionals. We are not alone. Fine, we are standing as a profession, but we work together for a goal. We have something that we are targeting, and we cannot do it alone. We work with, like as she said, the pediatric nurse work with the pediatricians. There's other people they work with too. They work with the laboratory scientists too, as well too, and some other people involved in the healthcare. So anywhere you find yourself, make sure you are working together to achieve a goal. So thank you so much, ma. So moving on to the next question, ma. What are the potential career paths and advancement opportunities for pediatric nursing? I think you answered that, but you can share more light on that.
Yeah, we can actually progress. You can there's no limit to what you can read now.
Yes.
By the grace of God, you can get to first, second, third degree, and you can get different certifications aside being a pediatric nurse. But there are other things you can do that brings out your work so well. You can do first degree, like I said. You can go into masters in maternal and child health nursing. I really hope that very soon we'll have masters in pediatric nursing or in child health nursing. Then you can also advance to PhD level, and then you do other specialties, other programs that enhances your understanding of the area where you are.
Okay. Thank you so much, ma. We really appreciate your response as regards this. So there's always career advancements. There's more you can do. There's more you can do. If you need knowledge, you need to search for knowledge. So there's more. There's room for you having knowledge. So you just have to make deliberate efforts to do that. Nobody will come and drag it from where you are. You have to live where you are. You need to advance. Nothing is advancing. You just see that those that are behind you, they are already at your gas. So sorry for using this word, but that's just reality. That's just reality. So okay, so the next question, okay, can you provide general insight into salary consideration for pediatric nurses, both domestically and internationally? What factors influence compensation?
Okay, thank you. Factors that influence compensation include the interest you have in the care of the babies or in the care of the children. Well, every country that wants a better tomorrow will place their pediatrician and pediatric nurses. They rate them so high because our tomorrow lies in these children. If we don't grow well, we can't talk about a better tomorrow. We're talking about people that are not intelligent. Some of those children probably have issues at birth. And so those things determine our remuneration. I would say that nationally, pediatric nurses should be rated. And I would say by now, Nigeria should have used the opportunity of having pediatric nurses around and place us on call duty, so that at every point in time, the pediatric nurses covers not only the pediatric ward, you cover the labor ward, you cover the line-in ward, and do periodic checks on those babies and see that they are doing well and identify issues earlier and ensure that intervention comes up earlier. So those things are there. We should be properly remunerated, honestly. If you ask me to place a value, I'm not sure Nigeria can cope with that value. But let me just say that look at the input of what we do. Look at the effort we put in ensuring that those children come out good. Look at the economic value we are assisting the country to achieve by making sure that the children are not children that will be spending so much on tomorrow. Because you know that when a child is disabled or a child has a lot of massive challenge, has a lot of economic impact on the country too. When we're supposed to be looking at this, we'll be spending on those things. So if you look at our effort in ensuring that Nigeria produce children that are intelligent enough to lead us right, then you will pay pediatric nurses very well.
Okay, so are you saying it's diverse in a sense, because the salary contribution as regards different institutes and depends on the value?
For now, Nigeria has not placed pediatric nurses on special salary package, but it will not be out of place to place them on special salary package.
Okay.
Knowing fully well, like I said, that our impact cannot be underestimated.
Yes, okay. I think I understand now. So, okay, to the last question here, ma. So, what advice would you give to someone considering a career in pediatric nursing?
Okay, please be driven by your passion first. For every specialty, there are challenges, but have a focus. It is your passion and your focus that will keep you moving. It does not mean that everything is rosy. Honestly, it is not rosy. But like I said, I look beyond the challenges. And if you pick up a career in pediatric nursing, so please look beyond the challenges. It may not look rosy today. It may not be bringing in so much cash for you today. But I tell you, the contacts, the relationship, the links we have gotten from taking care of babies sometimes pay more than the money. I managed a child by the grace of God, and I needed to travel out of the country. And because of the impact that I made in those children, in that child, we lost the child, but isn't it funny that despite losing that child, the parents were still interested in seeing what I am doing, and they practically made arrangements for my welcome in that country. And their relation actually hosted me. I didn't pay a dime to stay in that country till I left that country.
Wow.
For me, it is fulfilling because it means that even though we lost the child to the cold hands of death, the parents still see the impact of what I did for their child. I remember paying a visit to the family after the demise of the child, a few days after. And while everybody was waiting, the mother said, "Please greet this nurse for me. If it had been care that would keep my child alive, the care surrender will have kept her alive." So it's passion. So be passionate about what you are doing. When you are passionate, when others are seeing closed doors, you'll be seeing open doors. And doors will actually open for you because you see beyond what others are seeing. In fact, I never knew that I would enjoy being a pediatric nurse like this until I went into the specialty.
Wow. And
I saw various opportunities of collaboration, even beyond the hospital setting, speaking with NGOs, collaborating with NGOs to speak for the child. And like the slogan of pediatric nurses says that, we're the voice of the children. It sinks into me that I need to speak for a child wherever I find myself. And that has opened doors also. So it's not just, don't look at the immediate benefits, the immediate remuneration. There are a lot of benefits in whatever specialty you pick up. Just be passionate. Throw yourself into it. Give it your best. And when others are seeing closed doors, you'll be seeing opportunities that others are not seeing. And that will catapult you to a different level apart from what others are seeing.
Thank you so much, Ma. Really appreciate this response. So if you are trying to consider pediatric nursing, is the best. Let me just tell you, there's a lot in there. As she said, there's nothing fulfilling than you doing what you like, doing what you have passion for. She mentioned some things, focus and passion. Sometimes you can have passion, if you are not focused, you will lose it. That's just the reality. Focus and passion. Thank you so much, Mark, for the privilege. We are so grateful. NurseEmerge as a whole, we are so grateful for.
Thank you so much for the opportunity.
It's our prayer to have you, and we still want to have you more and more and more. Thank you so much, Mark.
Thank you.
So always stay tuned for NurseEmerge. Next thing we are doing, you do not know, but please try to subscribe, follow us, and if you have any question, that's very, very important. Drop it on the comment section. I know she will be ready to reply you and we'll get back to you, or you can just reach out to us on all our social media at NurseEmerge. Just say NurseEmerge anyway. You will see us there. Thank you so much. See you later.
Thank you for watching NurseEmerge. Remember to subscribe and hit the notification bell so you never miss an episode. Together, let's empower the nursing community to reach new heights. Stay inspired and keep pushing the boundaries of nursing excellence. See you next time.